Isn't that right, teacher? Are we ready?
Well, Kaspar, I'm ready.
I'm ready.
Everyone grab your tools.
Everyone grab your tools. His tools.
Yes.
Let him get his equipment.
Everyone has their tools.
Take it. Yes, take it. 1, 2, 3. Smoke here. Sir, it is still very current and never out of the agenda.
So old but never loses its importance.
Just as up to date.
It is just as important.
An important issue.
Wait a minute.
Everyone talking about
Please, just...
what happened, brother?
Friends, please look closely. We always remind you every single time. Gaffar Hoka is upset.
Honestly, he really is.
Watch these videos. They're important for you.
For you.
We already know this stuff.
Yes.
2. Have your loved ones watch these.
Yes.
It's important for your loved ones.
Yes.
Friends, talent is recognized through appreciation. While watching these, don't forget to subscribe and to have your loved ones subscribe as well. All right, let's get to this week's topic. Yes, Gaffar. So what is it? What's so interesting, important, and pressing about it?
Brother, patients always ask, will I have to use cholesterol medication forever? Is it not possible not to use it? I don't want to use it. We get a lot of questions about this. In daily practice, all internal medicine branches and family physicians who run outpatient clinics face these kinds of questions. In fact, we even get asked these questions at weddings, associations, or when we go visiting.
What's your cholesterol level? What's mine?
Yes.
So do you have cholesterol? Do you have bad cholesterol?
Yes. Now, doctor, actually the patient, when they're about to start a medication for cholesterol, doctor, at what level? When they ask that, if this person is curious about that number, is it 130, 180, or 220? The person who asks about that number never actually takes it. This is proven by experience.
Bro, there's also something like this. Now, you're searching well. Cholesterol and bad cholesterol, did they get married and now they have even worse cholesterol children?
Bro, in this show, we're going to eliminate bad cholesterol too. We're going to eliminate it completely.
There's a slip. Back to the start. Beginning. Is there cholesterol in the body? What does this cholesterol do? Do we need cholesterol? If it's so pitiful, why do they measure it?
We really need cholesterol. And cholesterol is an essential.
Essential. Is it something that smells like perfume?
No, it's something we need to get from outside.
So, something the body itself can't produce?
Yes, it's a substance we need to obtain from outside.
Yes. Okay.
And it's very necessary.
Something.
All cell membranes contain cholesterol. Especially nerve cells are the ones that contain more cholesterol. Also, almost all the hormones in the body are made from cholesterol.
We're coming to a very critical point. Hormone production. Androgen hormones, erection, masculinity. Without cholesterol, none of this happens.
So we really need cholesterol. So what's the deal with our struggle and ongoing battle with cholesterol, especially with cholesterol-lowering drugs? Actually, cholesterol isn't just one type. It comes in many different forms. And after cholesterol enters the body through the intestines, it has a particular characteristic. Bro, let's compare cholesterol to this. Let's say we ordered a wrap or a hamburger from a restaurant. Does that hamburger come to your house on its own? No, it doesn't. What do you need? You need a courier. All forms of cholesterol are transported by their own specific courier. They can't be transported without a courier. In other words, it's always a protein that does the transporting. That's why in medical textbooks, this cholesterol metabolism is called lipoprotein metabolism. So with cholesterol, there are couriers that bring it from the restaurant to your home, and there are those that take it from your home back to the restaurant. In this constant circulation, it will travel to the farthest point in the body, and if it's not useful there, it will be brought back. There's such a circulation going on, and each one is given a name. Professor, they name them according to certain criteria. They name them based on the cholesterol density according to their weight.
Now, why are we afraid of cholesterol?
Now, One of the primary types of cholesterol is called low-density lipoprotein, or LDL, which carries cholesterol from the liver to various bodily tissues and cells, and has a significantly high cholesterol density, which can be a concern for cardiovascular health. In fact, an even lower and more harmful type has been discovered called lipoprotein small a. This is what causes atherosclerotic plaques and narrowing in the vessel wall. It directly becomes a building block in this process. And
In other words, without this type of cholesterol, it would be impossible to build the plaques that cause narrowing in the vessels. Yes,
yes, one of the most important components of the plaque is LDL, or lipoprotein small a. That's actually our main target. The others, we don't really have any issues with the other types of cholesterol. And Professor, the main control center of cholesterol is the liver. The liver, so when you get your tests done, a whole bunch of cholesterol types show up. While these types circulate in the human body, they transform into each other, like you see LDL, HDL, NDL, VLDL, triglycerides listed. Think of all these as transporters, like international transport between countries. These are all forms that transform into each other during this transport process, but it is the LDL and lipoprotein small network that we consider harmful that causes vascular occlusion.
so low density,
Lipoprotein.
yes.
So after taking fat from the intestines, it is the first. Form chylomicron, triglyceride is high, cholesterol is low. Later, as it transitions into these different forms, the triglyceride decreases and relatively the cholesterol increases.
Because the triglyceride decreases, the cholesterol increases.
It increases its density, the density of the cholesterol inside it. So let's say when there are 100 units of triglyceride, 1 unit of LDL here is not very harmful. But it gets smaller, smaller, and smaller. What happens as the triglyceride decreases? This relatively, it turns into a more harmful molecule.
It's like putting 1 sugar in your tea, then 2 sugars, then 3 sugars. After 20 sugars, the tea becomes something else entirely.
Yes. And also, doctor, they say there's a good one and a bad one. This so-called HDL, high-density lipoprotein, it carries things back to the liver. That's why it's considered beneficial.
So it doesn't leave it where it is, it brings it back.
It collects it. What do you call this in a way? It's like a recycler, like our garbage collector. Our citizens, the recycler HDL does that job. That's why it's good. But having high HDL is a good thing, yet if you don't also achieve low LDL along with it, you haven't really accomplished something good overall.
So it means there are certain ratios between these.
Yes.
In other words, the body needs to have cholesterol. Yes. The types of cholesterol in the body should be in proper ratios to each other. They need to be present in the right amounts. Doctors know what these appropriate amounts are. Yes. If your bad lipoproteins are higher than normal and there's a risk, then regulatory medications are used for this. So why do doctors want these medications to be used? Why don't they want them to be used? So why are we afraid when using these medications?
Professor, when we talk about these cholesterol medications called statins, 90% of the drugs we mean are from the statin group. Yes, there are also 2 or 3 other groups besides statins, but mainly the statins we refer to entered the medical world around the 1980s. There was a significant increase in their use towards the 2000s. And in the 2000s, a drug called rosuvastatin,
He means statin.
rhabdomyolysis, which is the breakdown of muscle tissue, leads to kidney failure as a result.
If it accumulates in the kidney tubules, that's what happens.
At that point, that drug was withdrawn from the market because it caused deaths. At that time, such incidents led to a cautious attitude, even antipathy towards these drugs. But in fact, the rhabdomyolysis and resulting kidney damage caused by rosuvastatin, it was due to its use together with another drug called gemfibrozil, which lowers triglycerides.
So not because of the drug itself, but because of the combination.
And from the year 2000 to 2025, on tens of thousands of people, extensive studies have conclusively proven that these particular pharmaceutical drugs significantly reduce the incidence of dangerous vascular blockage, substantially extend the overall lifespan, and are therefore very strongly recommended for those individuals who are currently in the moderate to high cardiovascular risk group.
Now, friends, I did a little research on my own. I'm not talking about doctors, but the people who oppose this, what exactly are they thinking when they object? That's what I looked into. On social media, those who oppose it fall into two groups. One group says these are very harmful. Don't use them, don't use them, don't use them. But in the end, they say, look, you can use this one. In other words, they're trying to sell a product whose origin and certification are unclear. This is very important. Look, even its certification is uncertain. They're trying to sell a product that hasn't clearly passed any tests. Stay far away from these things. This is my clear recommendation as a doctor. The second group is more interesting. The second group says these drugs shouldn't be used by everyone. They shouldn't be prescribed this often. It's more reasonable, more logical to understand their concerns. We can have a discussion with them. So what do you say to them now?
I'm not doctor. Just like in previous episodes, you cited the Diyanet Encyclopedia for some topics and Wikipedia for others as your sources. As a doctor, my source, what I say about cholesterol in this program, can't just be my personal opinion, or rather, it isn't just my personal opinion. In fact, on this subject, it's not just Ankara's opinion or Ahmet's opinion.
What does Athens say?
There's no such thing. As doctors, we follow the European Society of Cardiology, or the recommendations of the American College of Cardiology, which are based on tens of thousands of people, or
Recommendations World Health Organization
their recommendations,
to recommend them.
so I can't have a personal opinion here. These guidelines are based on studies conducted on tens of thousands of people, and all side effects have been documented. The conclusions reached are the result of these studies.
Sometimes people say these medications have side effects. Well, yes, these medications do have side effects, but are you aware of this? Right now, there are people around us who are 85 to 90 years old, walking around with their bags. If it weren't for these medications, would cardiovascular diseases be this manageable? Would that really be the case? Do people really think so?
Dear Professor, there is a huge prejudice against these medications. There is a great deal of misinformation on social media. It's not possible for us to prevent this just with this program. Because we are the ones who brought this to light. All around the world, there are doctors who are against the use of statins, who don't recommend them or who criticize them. If, as doctors, we all share the same opinion on this matter, for example, is there any doctor who opposes the use of aspirin? Currently, there isn't. Now, if we as doctors were united, people could choose to use it or not anyway. But because of this division among doctors, the public, they themselves are the ones blowing this out of proportion.
But there's also something else, dear friends. My brothers, my friends, you know there are people who get cupping therapy on their buttocks to get rid of the harmful effects of the COVID vaccine. There are also people who try to clean their dirty blood by sucking it out with a vacuum. Please, please stay absolutely away from practices that are not registered or recommended by scientific institutions.
In other words, the European Society of Cardiology also recommends the following. They say, we recommend statin therapy for those in the moderate to high-risk group. Because as long as the name of this drug doesn't change, we won't be able to break the prejudice against it. My suggestion is to call these drugs atherosclerotic plaque stabilizer. You should remove the word cholesterol. If we call it atherosclerotic plaque stabilizer,
It makes a lot of sense. Then
people will say, oh, so we actually have nothing to do with the numbers, whether LDL is 70, 110, or 150. Of course, we have targets and we do tests to reach those targets. But our goal is definitely not cholesterol. It's to address the event that leads to atherosclerosis in our vessels.
now these days, there's something new. There's GAF. Doctors always recommend it to those who go to private hospitals. Have your lipoprotein A checked at least once.
Yes, it's truly a much stronger, more significant and powerful predictor.
In terms of plaque organization,
Yes. So once you have this checked, at the very least, it determines your risk of atherosclerotic plaque formation based on its level, and accordingly you receive a treatment. It's not something that's become routine yet. It's something that's done for a fee at certain specialized centers. Hopefully that will also become routine. Now, who should we give medication to?
yes,
Who should we give medication to? Should everyone use statins now? after a certain age? No. Just like with low-dose aspirin. Should everyone use low-dose aspirin after age 50? No. So what do the guidelines say? If someone has had a vascular problem, this could be a heart vessel. Maybe they've had a stent placed or undergone bypass surgery. Or it could be a neck vessel. Or it could be a brain vessel. Or it could be a leg vessel. Anyone who has experienced a vascular event must definitely use this. Absolutely.
For example, is high blood pressure considered a vascular event?
But if there is another risk factor along with high blood pressure, for example,
So high blood pressure alone is not enough.
it's not. Now, there's a website on the internet called Cardiovascular Risk Scoring. When you go there, you enter your own demographic information. It tells you your lifetime risk or your 10-year risk for cardiovascular disease. If you fall into the moderate or high risk group, that scoring system already recommends using statins and aspirin.
Yes, even if your cholesterol is normal.
Of course, it's like this. We don't recommend it to everyone. Moderate to high risk or diabetes is not considered equivalent to vascular disease today. Or for example, if someone has had a stent placed, undergone bypass surgery, or suffered a cerebrovascular stroke. There's also this, primary prevention for those over 75. In other words, there is no recommendation to prevent the disease before it appears in that age group. The studies for people over 75 are weaker. Because what is our goal?
We have recently got people to live over 75.
Yes, we've only recently managed that. So for those over 75, they add a note saying you should decide based on the patient.
Now let's summarize it like this. Cholesterol is an essential substance in the body. The body does not produce it. It is obtained from outside. After the cholesterol taken from outside passes through the liver, over time, with age, and due to various factors, its components change. As the proportion of LDL and lipoprotein A types of cholesterol within the total cholesterol increases, the likelihood of plaque formation in the vessels also rises. If you have certain predisposing factors, or if your cardiovascular risk is high or in the moderate-high group, you may need to use medication. Your doctor will recommend the dosage and duration of this medication for you. Concerns about side effects.
Well, bro, the most common side effect we see is myalgia.
Muscle pain.
Myopathy is extremely rare. Muscle pain. When there is muscle pain, we can reduce the dose of the medication. We can combine it with another drug, or we can switch to a different medication. If we have any doubts, we check muscle enzymes, what we call CKMB, to see if there is any damage, That's what we look for. When statins first came out, there were concerns like, let's do tests every 6 months regarding the liver. There was a prejudice that they were harmful to the liver, but that's not the case. But sometimes do doctors, some check every 6 months, some once a year. Let me just mention the group for whom it's contraindicated.
Who should we not use it for?
Yes, it should not be used in pregnant women. It should not be used in those with chronic active hepatitis.
Its safety has not been confirmed.
Yes, it should not be used in these cases either. There's also this. If my cholesterol is high, will it cause symptoms? Which symptom is related to cholesterol? It doesn't cause any symptoms? You will never know until you die. Yes, it does not cause any symptoms. And there's also one of the types of this cholesterol, triglycerides.
Does it cause itching in the ear? Someone once asked me, my ear is itching. Could it be because of my cholesterol?
There's no such thing. It doesn't have any specific symptom. Since we're informing our viewers, let me also mention this. Sometimes triglyceride levels can exceed thousands. This poses more of a risk for the pancreas rather than cardiovascular disease.
Yes.
With high triglyceride levels, we also need to make sure the person is not an alcoholic, does not have hypothyroidism, and does not have diabetes.
Yes.
So we need to confirm that because these conditions can also cause high triglyceride levels. The main problem with high triglycerides is not cardiovascular.
Friends, here's a little trick. Please ask this question to anyone who says these medications are harmful. What is your suggestion? Do you have anything to recommend? So, are we supposed to boil nettle and drink it? Are we supposed to boil thyme and drink it? Do you have any scientific publication or information about these? Please don't ask about these.
Now, our viewers will say they didn't mention diet or exercise at all.
Yes?
Actually, we already prescribe diet and exercise to all our patients. In other words, that's a given, it's a must.
Of course, absolutely. Yes, certainly.
But patients also say this: Doctor, I don't want medication. I'll take care of it with diet in 3 months. Now, scientifically, we know how much can actually be achieved with diet. What percentage? 10%. Multiply by how much? 20. Diet and exercise are already recommended. But our goal was never just to lower the numbers. What was it? It was to stabilize the plaque,
Yes,
atherosclerotic plaque stabilizer, because these medications
yes. More or less, that's the idea. The purpose has been achieved.
achieved.
Yes. Cholesterol medications, the risks of these drugs, the myths and legends about them, we've discussed these. Yes. Friends, let's not stray from the path shown by science, from proven and tested methods. They say these people just want to make money, that's why they're doing it. Yes, the electric company also wants to make money, that's why they provide electricity. The people who make cell phones also want to make money, that's why they make cell phones. But the fact that cell phones are profitable doesn't negate their usefulness, just like electricity is indispensable to us.
Yes, that's right, Professor. So many of the arguments of those who are against medicine are also like the pharmaceutical industry does this, but normalized false to market it for money. Yes, they do it for money, but if we use it unnecessarily, we end up serving their interests.
You can also use a car unnecessarily. A car is an expensive thing. If you buy it unnecessarily, you end up serving the capitalists in the best way. If you think about it this way, a different world will open up before us. Please trust your doctors. Do not stray from the path shown by science. Yes, stay tuned to Saint Medic. Stay healthy.
Goodbye.